Good morning, everyone, and welcome to our lecture on Career Pathways for International Health Graduates, IHGs, in Canada's healthcare system. Today, we will explore opportunities for international medical graduates, IMGs, and internationally educated health professionals, IHPs, in clinical, administrative, and research roles. This lecture covers job roles, licensure processes, applications, methods, Canadian examples, best practices, and recommendations, aligning with course objectives to equip you with skills to navigate Canada's healthcare job market. Ethical considerations, such as transparent credentialing and patient safety, are vital for trust and success. By mastering these pathways, you'll build rewarding careers. We begin with the lecture outline, providing a roadmap for our discussion. Following our introduction, let's review the lecture outline to guide our exploration of IHG career opportunities in Canada. We start with an introduction to IHG roles, defining their scope in healthcare. We'll cover key job roles, including clinical assistants, nurses, and administrators, with licensure requirements. Applications will highlight contributions to patient care and system efficiency. Methods, such as credential evaluation and job search strategies, will be paired with Canadian examples, like IMG roles in Ontario. Best practices, emphasizing ethical compliance, and recommendations, like using support programs, will ensure success. A summary will consolidate key points, preparing you for career integration. This outline aligns with course objectives to foster skills for navigating Canada's job market. Ethical considerations, like transparent licensure, remain central. This slide transitions to the introduction, defining IHG opportunities. Building on our outline, let's introduce career opportunities for IHGs in Canada. IHGs, including IMGs and IHPs, fill clinical roles, e.g., clinical assistants, non-clinical roles, e.g., quality specialists, and research positions, addressing healthcare shortages. Navigating licensure through provincial bodies, e.g., CPSO in Ontario, and immigration requirements, e.g., work permits, is essential. These roles enhance patient care and system efficiency, particularly in underserved areas. For example, an IMG clinical assistant supports physicians while pursuing licensure. Ethical considerations, like accurate credential reporting and patient safety, build trust. This introduction aligns with course objectives to equip you with skills for career integration. This slide transitions to defining IHG roles, clarifying their scope. Following our introduction, let's define IHG roles in Canada's healthcare system. IHGs encompass IMGs, physicians, INs, nurses, IPGs, pharmacists, and others, working as clinical assistants, nurses, pharmacy technicians, or administrators. These roles require credential evaluation, e.g., NNAS for nurses, MCCQE for physicians, and licensure by provincial bodies like CPSO or College of Nurses of Ontario. For example, an IMG may work as a clinical assistant pre-licensure. Ethical considerations include truthful credential submissions and patient safety prioritization. This definition aligns with course objectives to foster understanding of IHG roles, enabling integration. This slide transitions to key job roles, exploring specific opportunities. Building on our definition, let's explore key job roles for IHGs. Clinical and medical assistants support physicians or clinics, nurses, INs, and pharmacists. IPGs provide clinical care, and dental roles range from assistants to licensed dentists. Administrative, research, and public health roles leverage IHG expertise for system efficiency. For example, an IMG joins Iroquois Falls Family Health Team as a medical assistant. Ethical considerations include transparent qualifications and patient safety. These roles align with course objectives by offering diverse pathways, fostering integration. This slide transitions to clinical and medical assistants, detailing roles and salaries. Following key roles, let's examine clinical and medical assistants. Clinical assistants aid physicians in specialties like ENT, handling triage and records, while medical assistants support clinic tasks, requiring a medical degree and clinical experience. These roles are accessible for IMGs awaiting licensure. For example, Markham ENT Clinic hires IMGs as clinical assistants. Salary ranges from CAD 35,000 to 60,000 annually, depending on location and experience. Ethical considerations include accurate role representation and patient safety. These roles align with course objectives by providing entry points, fostering career progression. This slide transitions to nursing roles, exploring IN opportunities. Following assistants, let's explore nursing roles for INs. Registered nurses, RNs, and licensed practical nurses, LPNs, deliver patient care, while healthcare aides support basic needs, with high demand in emergency care. NNAS credential evaluation and provincial licensure, e.g., College of Nurses of Ontario, are required. For example, Trillium Health Partners hires INs via the Nursing Graduate Guarantee. Salaries range from CAD 60,000 to 90,000 for RNs and CAD 30,000 to 45,000 for aides. Ethical considerations include accurate credentialing and patient safety. These roles align with course objectives by offering clinical pathways. This slide transitions to administrative and research roles, exploring non-clinical opportunities. Following nursing, let's examine administrative and research roles. Quality specialists and program officers manage healthcare operations, while medical monitors support clinical research, leveraging IHG knowledge. These roles require a medical degree and organizational or research skills. For example, Appletry Medical Group hires IMGs for administrative roles, and Ergomed hires for oncology research. Salaries range from CAD 50,000 to 80,000 for administrative roles and CAD 60,000 to 100,000 for research. Ethical considerations include transparent qualifications and equitable access. These roles align with course objectives by offering flexible pathways. This slide transitions to applications, exploring practical contributions. Following roles, let's examine applications of IHG roles in Canada's healthcare system. IHGs enhance patient care through clinical roles like nursing, improve system efficiency via administrative roles, and address workforce gaps, especially in rural areas. For example, NIN at Trillium Health Partners boosts emergency care. Ethical considerations include prioritizing patient safety and equitable access. These applications align with course objectives by demonstrating IHG contributions, fostering integration. By applying these roles, you'll strengthen healthcare delivery. This slide transitions to patient care quality, detailing specific applications. Following applications, let's explore enhancing patient care quality. IHGs in clinical assistant or nursing roles support triage and monitoring, improving care standards and access. Independent roles like RNs require licensure, while assistants work pre-licensure. For example, an IMG at Pioneer Cardio Diagnostics enhances patient flow. Ethical considerations include competent care and patient safety. This application aligns with course objectives by showcasing IHG contributions to quality care. By engaging in these roles, you'll improve healthcare outcomes. This slide transitions to system efficiency, exploring operational contributions. Following patient care, let's explore improving system efficiency. IHGs in administrative roles, like quality specialists, streamline operations and records, leveraging clinical expertise. For example, an IMG at Appletry Medical Group optimizes clinic workflows. Ethical considerations include accurate data management and system equity. This application aligns with course objectives by demonstrating IHG contributions to efficiency. By enhancing functionality, you'll support Canada's healthcare system. This slide transitions to addressing workforce gaps, exploring shortage solutions. Following efficiency, let's explore addressing workforce gaps. IHGs fill shortages in nursing, dentistry, and rural care, particularly in Alberta and Saskatchewan. For example, INs and Northern Health Authorities rural programs support underserved areas, strengthening capacity. Ethical considerations include equitable care and patient safety. This application aligns with course objectives by addressing healthcare needs. By targeting high-demand areas, you'll enhance system resilience. This slide transitions to methods, exploring integration strategies. Following applications, let's discuss methods for IHG career integration. Completing credential evaluation through NNAS nurses or MCCQE physicians verifies qualifications. Securing licensure and work permits, e.g., via LMIE, enables practice. Leveraging job boards, e.g., healthcarejobs.ca, and support programs like EPIC-HC facilitates placement. For example, NIN uses NNAS for licensure. Ethical considerations include truthful submissions and patient safety. These methods align with course objectives by equipping you for market integration. This slide transitions to credential evaluation, detailing the process. Following methods, let's explore the credential evaluation process. IHGs verify qualifications through NNAS nurses, MCCQE physicians, or MDEB dentists, submitting to bodies like CPSO or College of Nurses of Ontario. For example, NIN submits via NNAS for licensure. Ethical considerations include accurate documentation and avoiding misrepresentation. This process aligns with course objectives by ensuring qualified practice. By completing evaluation, you'll progress toward licensure. This slide transitions to Canadian examples, exploring specific cases. Following methods, let's explore a Canadian example. A clinical assistant at Pioneer Cardio Diagnostics in Thornhill, ON. This IMG role supports physicians with triage and records, requiring a medical degree. Salary ranges from CAD 40,000 to 60,000 annually. Outcomes include Canadian experience and care support. Ethical considerations include accurate qualifications and patient safety. This example aligns with course objectives by demonstrating an accessible pathway. This slide transitions to a nursing example. Following the clinical assistant, let's examine a Canadian example. A registered nurse at Trillium Health Partners in Mississauga, ON. This IN role, via the Nursing Graduate Guarantee, requires an NAS evaluation and Ontario licensure. Salary ranges from CAD 60,000 to 90,000 annually. Outcomes include enhanced emergency care. Ethical considerations include accurate credentialing and patient safety. This example aligns with course objectives by showcasing clinical integration. This slide transitions to an administrative example. Following nursing, let's explore a Canadian example. A quality improvement specialist at Appletry Medical Group in Toronto. This IMG role manages operations, with a salary of CAD 50,000 to 80,000 annually. Outcomes include streamlined processes. Ethical considerations include transparent qualifications and equity. This example aligns with course objectives by demonstrating non-clinical pathways. This slide transitions to best practices, exploring integration strategies. Following examples, let's discuss best practices for IHG integration. Submitting accurate credentials to NNAS or MCCQE ensures compliance. Engaging support programs like Healthcare Connections aids placement. Targeting high-demand regions like Alberta maximizes opportunities. For example, NIN joins Saskatchewan's recruitment pool. Ethical considerations include truthful reporting and patient safety. These practices align with course objectives by fostering ethical integration. This slide transitions to recommendations, providing actionable strategies. Following best practices, let's provide recommendations for career success. Engaging regulatory bodies like CPSO early clarifies requirements. Pursuing observerships or volunteering builds experience. Using job boards, e.g., Indeed.ca and networks like IMG Secrets streamlines searches. For example, an IMG volunteers for exposure. Ethical considerations include transparent communication and patient safety. These recommendations align with course objectives by promoting efficient strategies. This slide transitions to ethical considerations, exploring integrity. Following recommendations, let's discuss ethical considerations. Ensuring transparent credential reporting to NNAS or MCCQE builds trust. Prioritizing patient safety in roles like nursing ensures quality care. Promoting equitable access addresses underserved needs. These principles align with course objectives by fostering responsible integration. By prioritizing ethics, you'll enhance credibility. This slide transitions to evaluating success, exploring assessment. Following ethical considerations, let's explore evaluating career success. Measuring job placement rates tracks hires, like IMGs and assistant roles. Assessing licensure and employment outcomes evaluates progress, like INs achieving RN status. Refining strategies with regulatory feedback improves approaches. Ethical considerations include transparent reporting and inclusive feedback. Evaluating success aligns with course objectives by ensuring data-driven integration. This slide transitions to the summary, consolidating key points. As we conclude, let's summarize key points. IHG strategies secure roles like clinical assistants, nurses, and quality specialists through ethical licensure and immigration compliance. Canadian examples, like roles at Pioneer Cardio, Trillium, and Applet Re, illustrate pathways. Best practices, like accurate credentials, and recommendations, like targeting high-demand areas, overcome barriers. These align with course objectives to equip you with skills for navigating Canada's job market, enhancing healthcare through ethical integration. By mastering these, you'll achieve impactful careers. Thank you for your engagement. This slide provides references for IHG career integration. Internationally Educated Health Professionals, Canada.ca, 2023 details pathways. Credential Assessment for Nurses, NNAS, 2023 explains nursing evaluation. Medical Council of Canada Qualifying Examination, MCC, 2023 covers physician licensure. IMG job listings, Indeed.ca, 2023 and Healthcare Job Opportunities, healthcarejobs.ca, 2023 list roles. We also reference to course notes by Professor Pirouzi to offer more insights. These align with course objectives, guiding you toward successful careers.